Over the past 10 or 20 years, there have been a number of clinical trials looking at the best way to give adjuvant or neoadjuvant chemotherapy to breast cancer patients to decrease their risk, mostly of systemic recurrence, but also of local recurrence. These chemotherapies have been developed in a manner generally with randomized trials that is comparing old treatment A to some new treatment B. Often those changes involve changes in drug. For instance, if there's a new drug available, changes in dose, or change in the number of cycles. So that the number of cycles of chemotherapy we give has pretty well been studied in a scientific way. Obviously, one doesn't want to overtreat and one doesn't want to undertreat. So there have been any number of trials looking at the appropriate number of cycles for each stage of breast cancer. As one might suspect, the lower the stage of breast cancer and the less risk of systemic recurrence, and presumably a lesser burden of micrometastatic cells, many of those chemotherapy regimens contain fewer cycles than patients with large multi-node positive or HER2 positive breast cancers. For instance, in node negative breast cancer, one of the more common regimens is 4 cycles or 4 treatments of drugs known as Taxotere and Cytoxan. These would be given every 3 weeks times 4, which takes a little over 2 months, and then the patient has completed the chemotherapy. At the other end of the scale are patients with HER2 positive breast cancer that take 4 months of chemotherapy, often on a weekly basis, followed by Herceptin out to a year. So that the range may be 4 cycles versus something like 18 cycles or 30 cycles when one includes the Herceptin out to a year. Most of these have been studied scientifically such that the patient can feel comfortable that they're not being undertreated or overtreated.
Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.